right now I'm still dealing with going to the bathroom. Like, it's a whole life change. Like, I can't, and I'm gonna be transparent, I can't pee like I used to pee. It's totally different. I depend on depend.
Could you recognize the signs of bladder cancer? Like, would you know if you have bladder cancer right now? Who is most at risk? And are there things that you can do to minimize your risk or increase your risk? We're talking about bladder cancer because it's getting more attention now due to NFL star Deion Sanders, Coach Prime, going public with his bladder cancer diagnosis. And we're joined by an expert on this. We're joined by Dr. Robert Given, urological oncologist at Urology of Virginia the past 31 years, also professor of urology at EVMS. Side note, he was also my doctor who helped with the surgery for my prostate cancer treatment. And so, man, it's good to see you.
That's good to see you. Thank you for having me here.
I guess there won't be any copay charge for this visit, right? This one's on the house.
Yeah.
So Coach Prime has said that he, is glad that his going public is helping men have conversations, get tested, which is kind of like my lead-off question. Is like, with my prostate cancer, I mean, there are two screening tools. There's the PSA blood test, and then there's the digital rectal exam.
Correct, yes.
What is there for bladder cancer?
Well, first of all, I really give kudos to Coach Prime for going public. That takes a lot to do that. And, will increase awareness for bladder cancer, I think. Unfortunately, there's really no screening tests for bladder cancer. But the easiest test to do is a urinalysis.
But I mean, how would you? So I mean, like every year, I go in and I get the blood draw and the finger check.
Yes.
How? So
a urinalysis, the most common sign for bladder cancer is blood in the urine. And sometimes you can see it grossly if it's a significant amount, but a smaller amount you'll see on the urinalysis, what we call microscopic blood in the urine. And so, I mean, I would advocate to have it done with your yearly exam when they're doing the blood work, but it's not necessarily seen as a screening test by the cancer authorities right now. So, it's just hadn't been felt to be cost effective.
Why?
I don't know if I can answer that. There have been studies that have shown that checking urinalysis is beneficial. It will pick up bladder cancers early. It's just, I think it's for mass screening, you look at the cost of it, and then a lot of people have blood in the urine for other reasons, not cancer, and so then it elicits a workup that can be costly. So that's probably why it's not done on a regular screening basis.
So how can you be proactive?
I don't really see necessarily a downside to doing it because urinalysis is very cheap.
So how can you be proactive?
I think there's certain factors with cancer we can mitigate, right? You can't control your genetic background, what your risks are from what you're born with.
So if you have a family history of bladder cancer, that should be a red flag?
There is an increased risk. But more commonly, it's environmental exposure. And the most common environmental exposure that can give you bladder cancer is smoking. So the number one thing you can do is actually not smoke.
How big of an impact is smoking?
It's big. Yeah, it's the number one risk factor
for bladder cancer.
Yes,
I would imagine, based on what we know about Coach Prime, I don't know it personally, but I'm guessing he wasn't a smoker.
Yeah, I couldn't imagine him being a smoker and being the athlete that he was. I never heard of anything about that. But I don't know specifically why he got. There are some people who you don't know why they got.
What are the other risk factors? You say smoking. What are the other kind of demographics?
There's some environmental risk factors. Agent Orange has some data with that. There are some heavy metals, some of the dye industries. A lot of the stuff.
When you say heavy metals,
there's certain heavy metals that may increase risk of bladder
so, like,
cancer.
depending on what career field you're in. Correct, and your exposure to that?
Most of those industries really, that's more from the past. They really don't have that as much exposure at this point to that. That's a little harder to control, depends on what your job is.
Yeah.
I don't think his job ever exposed him to
No.
anything. But there are, I mean, I've had some patients who have absolutely no risk factor and they get bladder cancer. It's just,
Out of your 31 years, what's your ballpark figure of how many bladder cancer patients you have treated?
thousands.
Thousands.
Thousands, yeah.
And any way to glean on whether a large percentage of them were from smoking or
Yeah, greater than 50% are from smoking
All right.
or have a smoking history.
who's more
It doesn't rule out that just because you don't smoke doesn't mean you can't
Yeah.
get it.
men or women? Who's getting bladder cancer more?
It's roughly 3 to 1.
3 to
male
1.
to female.
Do we know why?
I think traditionally wise more men have been smokers. Now that is starting to shift as more women have smoked, starting in the 60s or so when they started to become a little more liberated and they started smoking. So that's shifting some. Fortunately, less people in the younger generation are smoking now, so hopefully that the overall number will improve over the years.
What other all right, so you said gender. What about race?
Race, so it's a little more common in the Caucasian race compared to African American. I don't have a explanation
Yeah.
for that. I don't know if there's a difference in the smoking rate between
Whites and blacks.
whites and blacks. Yeah, I don't know.
What about age? Because I know, with my prostate cancer, they're saying if you have a family history, if you're African American,
Yeah.
start getting screening at 40 or 45. What do we know about when you should really kind of heighten your awareness for bladder cancer?
Yeah, so the peak age is actually 73. So
73?
Yeah, so it's more of an elderly population. So Coach Prime doesn't really fit
No,
any of the
no.
classic features that you would think. So 73 is the peak age. So I think starting, it's very reasonable. We should all be getting physical exams by our primary care, certainly starting at least age 50. And maybe they should be checking urinalysis periodically. And certainly if you ever see blood in your urine, or you have symptoms such as increased urinary frequency, going more often, having to rush to the bathroom some, occasionally those can be signs of bladder cancer.
That's got to freak some people out to
Yeah,
hear
more
that.
commonly-
That if women,
Yeah.
have I been going to the bathroom more often? Have I been going? Because that could
Yeah.
also mean that maybe you have an enlarged prostate.
Correct. So in men, it's very common with enlarged prostate too. In women, it's an aging bladder. Oftentimes, they have more frequency. So that's a very subtle sign.
Okay.
So that one's hard to pick up on.
All right. We have much more to unpack with Dr. Given, including what are the treatment options and also a special organization that he is with, the Surf Foundation. And we're not talking about riding waves. Much more on that when we come back on The Healthy Dude. Welcome back to The Healthy Dude. I'm Kurt Williams. We are continuing our conversation with Dr. Robert Given, professor of urology at EVMS and also a urological oncologist with Urology of Virginia. There is a quote that I want to read to you from one of Coach Prime's doctors, and it was, quote, "We removed the tumor. It was very high grade and invading through the bladder wall, not into the muscle layer, something we call very high risk, non-muscle invasive bladder cancer." Can you break that down so that we can all
Sure.
understand that?
Sure.
What does that tell you?
So there are basically 3 layers to the bladder. You have the inner layer, which is just the mucosa, the inner lining. And then there's a thin layer before the muscle. So the muscle is the 3rd layer. There's a thin layer. It's called the lamina propria. So that's what she meant when she said that. It went into the 2nd layer of the bladder, but not into the muscle. So bladder cancer is divided into 2 main categories. You have non-muscle invasive bladder cancer, which is the first 2 layers, and then you have the muscle invasive bladder cancer. And the treatment is very different between the two. So if it's superficial, meaning just the inner line of the bladder, usually we just go with the scope, remove the tumor, and there's medications that we put into your bladder that we actually do in the office to lower the risk of recurrence or progressing to getting worse.
He had his entire bladder removed.
Yeah, so when it goes in that 2nd layer, you would rarely ever do it for just the 1st layer, the inner layer. When it goes in the 2nd layer, that is an option to go to removal of the bladder. It's also more commonly where we put the medications in the bladder, and if that doesn't work, then you move on to removal of the bladder. What I kind of gleaned out of what her comments is that there are some aggressive features, how the cells look, and it sounded like he had some real aggressive features that pushed her to recommend removal of the bladder.
And then, from what I read, they used a part of his intestine to create a new bladder. Is that common?
So when it goes into the muscle where you have features such as his, and you decide to remove the bladder, there are options. So obviously you need a place for the urine to go. So there's basically 3 options. So you can do what we call ileoconduit. It's probably the most common option. And so that is when we take a piece of small intestines, we bring the ureters, the tubes come from the kidney into one end, and the other end comes to your skin where it drains into an ostomy, into a bag. So since most of these patients are elderly, that's probably the more common procedure that we do. In a younger patient, you can do a little more complex things, such as you can take a larger piece of intestine, you open it up, and then you fold it into a sphere to make it like a neobladder, new bladder. And you can bring the ureters in, then you bring that down to the urethra, the water channel, and you sew it in there.
Have you done this before?
Oh, sure, yeah. And it has its pros and cons. The advantage of it, there's no external appliance.
Yeah.
The disadvantage is it's a little longer operation, a little more things that can happen with it. So when
you say a little more things that can happen, like
complications.
Okay.
Complications. And later complications. So we tend to reserve that for someone younger, such as Coach Prime. Yeah, he would be a perfect candidate for one. Plus, the way his cancer was, not being invading to the muscle, made him a really good candidate for that too. But it's not a perfect. The new bladder is not like your old bladder. It doesn't have the thick muscle backing, so to urinate, it's a little more complicated. They actually have to contract their abdominal muscles, sometimes push there to try to empty well. So the long-term side effects from it, one, sometimes they don't empty all the way and they have to catheterize to empty the bladder. And there is some risk of urinary incontinence, leakage of urine from it.
Oh.
And so I think he's actually mentioned, and it's really, most of the time early, there is some incontinence sometimes.
I think he made some reference to
He
learned to
did.
depend on Depends.
Yes, so he's, sounds like he's having a little bit of incontinence.
Yeah.
Hopefully that will improve over time. But those are the risk factors, and neither one is like as good as your old bladder, but it doesn't have cancer in it. So.
Do you find that some men, when they hear that, and I'm gonna have to end up maybe temporarily, or I don't know, however long, having to wear diapers. I mean, I know I've just in going public with my prostate cancer journey, I've just heard from some men who are like, first of all, I'm not gonna have the finger test. Nobody's gonna put their finger up my butt, or they worry about, I'm gonna have to wear diapers, or is it gonna impact sexual performance? And so, do you find that you have to have conversations with men to stress? Have the big picture because you want to live.
Sure. Yeah. There is some reluctance, obviously. Bladder cancer is unfortunately more lethal than prostate cancer. So if it goes in the muscle, there's a significant risk of mortality from that within 5 years. So that kind of reframes things for people. Then you start thinking less about, okay, I want to live.
Yes.
Right? Prostate cancer, we can keep people around a long time
Yeah.
with prostate cancer, so it's not as lethal.
Are you saying that there's a greater, I'm sure there's a greater urgency to catch all cancers early, but are you saying that there's maybe a heightened urgency in catching bladder cancer before it spreads outside the bladder?
Yeah, absolutely. One, you want to catch it before it goes in the muscle. That's the first big fork in the road because that really changes survival. Fortunately, 75% present as superficial and 25% are muscle invasive. So the majority we catch early. If it gets metastatic, so outside the immediate pelvis, long-term survival is not great. We do have some chemotherapy, immune therapy, and so forth that cures some, but it's a challenge. So we definitely want to catch it early.
One thing, just as I was reading up on this, it seemed like it was also saying that if you have been exposed to prior radiation, you were increasing your risk for bladder cancer. And considering that was my treatment method for my prostate cancer, I had 5 weeks of daily radiation, and then I had the radioactive seeds. That's where that was part where you helped him with Dr. Shaves. So what?
It's low, so don't panic. But yes, radiation is a risk factor. Any sort of pelvic radiation, the bladder does get exposed to. Even with the prostate, they focus as well as they can, but the bladder does get a little bit exposure to it. The overall incidence after radiation therapy for prostate cancer is 2%.
2%.
So
there's a 98% chance
you won't have it.
I won't have it.
Yes.
But
and that's usually that's usually years down the road.
Okay.
If it were to happen. But
okay.
yeah. So if you ever have blood in urine, let me know.
And make sure that I'm getting those.
We do that when you come in. Don't we?
Urinalysis to make sure.
Yeah.
Okay. Still much more to chat with you about. The SURF Foundation, because of some research projects regarding bladder cancer. So we want to get to that. Still a lot more to unpack with Dr. Given on The Healthy Dude. Welcome back to The Healthy Dude. I'm Kurt Williams. We're having a conversation with Dr. Robert Given about bladder cancer because of Deion Sanders, Coach Prime, going public with his diagnosis. And we want to continue that conversation. When someone like Coach Prime goes public, what is your hope that his going public, what the impact will be?
I just think to raise awareness. I don't think people think about bladder cancer that much.
You know what? I got to say, I would think it seems like we hear much more about prostate cancer than bladder cancer.
You do. A lot of it's prostate cancer is far more common. Bladder cancer is the 6th most common cancer. Like 83,000 new cases a year.
But you were saying earlier that bladder cancer is more lethal.
Correct.
So, yeah, I mean, I guess it's never crossed my mind to kind of have an awareness about that.
Yeah. So, I mean, I think it's great when someone a public figure like Coach Sanders, does that to raise awareness and just so people will think about it more. So if they do have some urinary symptoms, do see some blood in the urine, that they go see the doctor and don't just ignore it.
I would think, and not to kind of get too graphic on this, but to kind of, make sure that we're broadening this out to, the women that are, that are listening. For guys, hopefully we're kind of, we got to aim, so we're going to be more aware of like, oh, hey, why do I have that color in my urine? But for women, I mean, I can't imagine that's something that they check frequently to kind of look and see. Yeah. So what? I mean, what's your message?
I think maybe they should look and see.
Okay.
Unfortunately, women.
But maybe at a certain age, right? I mean, it's not something like if you're.
Well, I think if a woman ever sees blood in the urine, they should probably get checked out.
Yeah.
And women sometimes get diagnosed a little later because women have more urinary tract infections, and when you have a urinary tract infection, sometimes you can see blood in your urine. So oftentimes it just gets written off as a urinary tract infection. And so sometimes it takes a while before they actually present because everybody thinks it's just a urinary tract infection. So, a younger woman, urinary tract infection, that's probably what it is when they see blood in the urine. Older person, though, and particularly if they get more than one, they should get checked out because it could be something more serious.
You were on the executive committee of the SURF Foundation, and we're not talking about riding waves.
No.
What is the SURF Foundation?
So it stands for the Shellhammer Urologic Research Foundation. So it's an arm of Urology of Virginia where we're doing research. So it's a foundation for research that we have.
And y'all have, from what I understand, a couple of research projects that you're either launching or underway for bladder cancer?
Yeah, we do. We have a large bladder cancer database. So everybody with diagnosed with bladder cancer goes into the database. We have a couple of researchers who are reviewing the database, doing some projects with that. We also have a research arm where we're looking at clinical trials with bladder cancer. We actually have 4 for superficial bladder cancer right now.
What are you trying to find out? I mean,
these are all agents to lower the risk for superficial bladder cancer, lower the risk of recurrence. So there's already FDA-approved agents out there, but sometimes they fail, and so there's some other agents, second-line treatments that we're looking at.
You also have a bladder cancer support group.
We do. There is a bladder cancer support group that we started a year or two ago.
What's
And-
the? I mean, what? It's just to. Is it? It's what? Former patients. It's current
It's former-
patients.
It's former patients and current patients are always told about it, and it's certainly very reasonable. I think it just helps to talk to people who have been through what you may be going through, or after treatment, if there's some issues that you're having, it helps to talk to someone who's had issues. So it's more patient-driven. We do have our bladder cancer nurse navigators there, and they're providing support, and occasional physician support too.
Is there, diet? I mean, exercise. Does it, beyond? I know one big takeaway is if you're smoking, stop smoking.
Correct.
Because just of not only bladder cancer, but just what you're doing to your lungs and heart disease and
I don't think vaping's any better. Everybody thinks cigarette smoke, but we don't have enough data on vaping yet. But I can't imagine it's going to be significantly better compared to cigarettes.
that's probably perked up some ears. So what you're saying, because I think people
yeah.
do
I mean,
have
it
a
still
sense. I think people do have this sense, like, well, it's not the nicotine. I mean, there's got to be something, But what would be your concern about somebody who's not smoking but vaping and thinking that that doesn't have any?
Those things are high heat, right? So the heat that generates are heavy metals that have been shown to be in their smoke content, and we know that it's not good for the bladder. So what happens is no one thinks that what comes in your lungs is actually going to end up in your bladder. But when it gets in your bloodstream, your kidney is a filter. It filters out the toxins. They go down to your bladder and they sit in there for 2 to 3 hours, just kind of bathing the bladder before you void. So if you keep putting more toxins in your bladder, it doesn't like it.
Anything else regarding diet or alcohol consumption, exercise, anything else that would help minimize your risk?
I haven't seen any data
Okay.
for any of those on bladder cancer. Obviously, with some other cancers, they're helpful, but I haven't seen anything on bladder cancer.
What do you hope are the big takeaways? I mean, for this, because we've unpacked a lot, but I mean, what do you hope really, just real quickly, like what are the 3 takeaways?
I think 3 takeaways. 1, prevention. Obviously, don't smoke. 2, awareness that if you do have some symptoms, do see some blood in your urine, seek medical advice. And 3, just to have someone that prominent to come out and talk about it, so there's not shame involved when you have major surgery, you have some lifestyle changes. I think that's great that it was open. He doesn't fit the classic picture. He doesn't really have any of the risk factors. And I think it was totally picked up just on some X-rays he had.
Dr. Given, it's good seeing you again.
It's good seeing you.
Kind of like in this, setting.
Yeah, I'm in your environment now, so this is your home.
All right, and I guess I don't know. I guess I have to check my calendar to see when I see you again just to see how.
We'll send you a reminder.
I'm sure you will. All right, Dr. Given, thank you so much. A urological oncologist with Urology of Virginia, professor of urology at EVMS, joining us here on The Healthy Dude. And we thank you for joining us on The Healthy Dude.